Dr. Linda, welcome to the VBF December 2019 Facebook Live session with world-renowned expert, that's how we think of her, our psychosocial expert, Leslie Graff. She's traveled the world with Operation Smile for, what, 20 years now? Mm-hmm. She's been with VBF for 15 years, right? 15 years as our expert. We already have 2 people on. Oh, hi, Kristen and Aaron, saying hi to you all. So today we're going to answer questions. Leslie will be answering questions on living with a vascular birthmark, some of the psychosocial issues. Is it more difficult during the holidays? You and I were just talking that everybody deals with problems during the holidays, right? Like, exactly. It's tough on all of us. But add to that a new mother, a new baby, doctor's appointments, holiday get-togethers with families. The baby has a birthmark. You've got to answer their questions. They all want to see the new baby. You're stressed.
A lot of conflicting emotions in those settings and those situations. It's just a lot to process. So I think there's, we know that first off, there's all these extra social activities, right? Different parties you have to go to. People are asking questions. There's a lot of family time, which not everyone has the easiest family dynamics, and everyone has an opinion, right, about everything that's going on in everyone's lives. So especially when you're dealing with things like this, and there's not always, consensus, even amongst parents on treatment
or
so
couples, not even with couples.
The
husband, I've got a lot of moms that say, no, my husband doesn't want me to put a strawberry bathing suit on my child because it just emphasizes the birthmark.
Exactly. And there's in-law situations, there's so many dynamics, and then there's just what everyone feels at the holidays, which is often sort of some melancholy as we sort of thing that is good. Like, it's a time when we dive really deeply inside of ourselves to a lot of our really core emotions and things that we value the most. And so at times it's like, hey, I see this gap between what I hope for or would like or what would be ideal and what I have actually in my life. And so it can often bring some depression, some sadness, some other things that are really difficult to deal with when you think, wait, this is supposed to be the happiest time of the year when I'm enjoying family and friends and all of this, but instead it just sometimes makes things feel worse.
Well, and that's why we're here.
Yeah.
Because I think it's a great ending to our monthly Facebook Live sessions to have you here and talking about these very important topics. I'm here live right now. So mostly right now, oops, sorry, I gotta make sure I turn that volume down. Get that volume down, I always forget that. So right now, Kristen says hi. Delgado, Jody says hi. Mentor's on, Scott's on, saying hi. Candy, Shannon, Hawley, April's on, and Amanda. So everybody's kind of saying hi.
Thanks for joining us, guys.
Yes, thank you, and happy holidays. And we're ready to take your questions. We have 1 hour. We actually have 57 minutes left. Hi, Sarah and Scott, saying hi to us both. And, Scott and Kristen and a bunch of people from VBF just went to a fashion show that was to raise money. And
amazing.
A lot of the people that were at the fashion show that had been going for several years had never seen anybody with a birthmark. So we had people, Kristen arranged it all, a superstar that she is, getting like some of our birthmark families' children to actually participate in the fashion show by being models. And there was tables. Scott had a ambassador table.
Representation matters, right?
Yes.
That's awesome.
So, so Mentor's asking a treatment question. How many treatments can I do per 1 year for hemangioma? Mentor, so we're answering questions, mostly psychosocial today, but you can email me at vbfpresident@gmail.com, likely because you are an adult. It's not a hemangioma, but I can get one of our expert doctors to look at your picture and tell you how many treatments. Like if it's a port wine, you can have them every 3 to 4 weeks. But without seeing your picture and really knowing, I can't compliment. And that's outside of Leslie's parameters, right? Elaine is on, and she said, I've lived with my birthmark on my face. It sucks. Was called Beast as a kid, but now no one even notices it. pretty amazing.
Yeah, I love to hear stories of resilience, how people can go from having experiences that are negative with that, because often many people do, right? Not because of our own choice or our own way of processing it, but the immaturity or the lack of compassion, empathy, and understanding of people around us. And sometimes as we mature and get to better places, we're better able to fit it into our story without having it define us in really negative ways.
Mm-hmm. So Candy has a question. What do you recommend for an adult who never got laser surgery and whose port wine's saying to stick around harder? And again, a little bit out of the psychosocial, but I can tell you both Dr. Nelson and Dr. Geronimus welcome patients that have any thickening or any blebs. The new Prima laser can flatten the blebs out. You can do really, really well, Candy. So if you want to post, April's on here now, our social media expert, and she can post Dr. Nelson's email for you. It's jsnnelson@uci.edu, or we can give you his email through VBF, and he'll tell you about lasers and what he can do for you. And Elaine, who said nobody asks anymore, said the only one that does is our children.
And probably a lot of those kids are asking out of curiosity as much as, any type of malintent or desire to hurt your feelings, but really curiosity.
Yep. So Carol's on and Sergey's on, our buddy Sergey. I think Sergey needs to join VBF. He's always on all of our events. I think we need him as on a committee or as a volunteer person, because he's always on all of our things, and he knows vascular birthmarks really well. So I think we need to put in the work.
That's right.
On one of our committees.
You got to join the cause here.
Join the cause, Sergey. Come on, Sergey. We need you. So Jody has a great question. She's saying hi to both of us. Hi. Kisses and hugs to the girls, and to John too. I don't want to leave John out of the kisses and hugs. She says, as you both know, my daughter Meg is 4, and we may be far away from this, but what are the pros and cons for supporting her emotionally and using makeup to cover the birthmark? I've always thought about telling her that makeup can highlight her beautiful features, but don't want to minimize her emotions about her facial difference. I think that's a great question.
Yeah, this is a really common question that I think I've had so many times over the years, because it's a difficult space. One of the biggest spaces, I think, within living with a visible difference is being okay with yourself just as you are, and also using various means, either treatment or makeup, to change that or to minimize that difference so that it's not as visible to other people. And as we look at sort of the feelings surrounding that, lots of us wear makeup on a daily basis because it makes us feel more comfortable. So extending that option to people, especially those who have a visible difference, is a very appropriate thing. I think sometimes, however, if the person feels no one could ever see them without that, they felt very insecure without it, that's when we want to try to, ensure that people really have a sense of comfort. But it's not okay. It's okay to want to make changes in the way that you look, and it's okay to wear makeup, and it's okay not to wear makeup, and both of those are acceptable. And I think as we explain that too, when we talk about whenever you have a circumstance or situation, you identify what's stressful for you. Mm-hmm. So if what's stressful for you is people staring at you, people making comments, this is one way that minimizes the stressor for you.
I think it's also important not to hook the makeup and the birthmark together.
Yes.
Right? Look at, not everybody's hiding something. Some people are just using it, like you said, to enhance their beauty, or like me, minimize wrinkles, and so to say, you can use makeup, and guess what? It also covers your birthmark type of thing. Mm-hmm. Like, it's not, makeup just wasn't created for the birthmark. Yeah, I like that. And John's on, so hi, John. Elaine was saying, I think this is adorable. She said her daughter's birthmark is in the shape of the logo of the country her and her husband met in.
That's awesome.
You got to send me a picture of that, Elaine Douglas Rue. Yeah, I want to see that. Nicole says hi. So she says, as someone growing up, Elaine says, with a birthmark on my face, growing up having the option to cover it up was something that gave me a comfort. Just be sure to help her with the color and make sure it is the right makeup for the birthmark. I use Dermablend. And that's true, because I've seen people come to our conferences and maybe they couldn't afford a really good makeup, and actually kind of makes it more obvious. So we have 2 makeup artists on our website, and they provide free samples for anybody who wants to try, and they come and do the makeup at the conferences. But yeah, get a sample of a makeup that's made for a birthmark. You don't want to try something that's going to make it look worse.
I think too, sometimes areas like this, or any areas where people feel a little bit of hesitancy or emotion, they sometimes feel like they have to hide it or whatever. And so I think being really open about, let's try this way or let's try this way. Like you can, because makeup is about putting on different looks. It's about making different changes. So if there's also a sense of like, you give them the tools to feel as much control as possible, to have as much understanding or skill in what they're doing too, it helps it to achieve the outcome that you're looking for, which is the most typical appearance, so that they feel as comfortable as possible.
I like that. Erin asks a really good question, and I get a lot of private messages about this. She's saying she finds herself struggling with trying to have another child because of how traumatic everything was around her daughter's birth. By the way, my Port Weinstein study on measuring PTSD in mothers as a result of the diagnosis is off the chart, with yes, high hypothesis confirmed for like 73% say it was traumatic, and their number 1 fear is that their child will have Sturge-Weber. So very significant. So what she's saying is, do you find that this is common that after, and I mean, you could speak to this.
Yeah, and I can speak to this because I'm a mother of 3 sons. My second son was born with a Port Weinstein, and also after 7 miscarriages. So I had a lot of kind of trauma and emotion around having children. And so one, I think it's really important to acknowledge the experience that you've had, to acknowledge the emotions, right? I went through a difficult experience. Also, having a child born with a vascular anomaly is a surprise. Nobody goes into a pregnancy thinking this is what's in their future. So it's a surprise. There's a shock factor. There's an adjustment factor. There's a lot that goes into that. But I also think for me, when I'm trying to cope with unknowns, we can't control the unknowns, but we can think about what are the positives that came from the child that you have? What are the strengths that have come in you, even from this experience? And so it's important to acknowledge the reality of those emotions, but then find positive ways to work through those. What are things you can do that make you feel more powerful, more in control? Because the truth is, there's so many different variables in life that could constantly come up or happen, but it's just reminding ourselves, okay, you know, even if this did happen again, I would get through it just like I got through it this time. And you take things really day by day and work through it. Project way out into the future and worry about things that haven't even happened yet. And that's something I do with my kids all the time. Like, we can't think that far out. We're not there yet.
One of the things I say to the moms that write to me and say, what's the statistical probability? And I'm like, let me tell you something. You could have the most perfect child without a birthmark, and they could end up crazy. You just don't have any way to predict. You think even if your child is born looking perfect, there's no guarantees they're going to be perfect.
Exactly.
Life
everyone,
is,
as a child life
everything's
specialist,
a risk.
Working in a hospital, you see children with everything under the sun. And sometimes you think, how is anyone born healthy? But you kind of realize that sooner or later, all of us across our lifespan have some health challenge or another. Like rare is the person who has not had a surgery, a chronic condition, who doesn't have cancer, like something that occurs over the course of their lifespan.
I have
They're just different.
A book that I want to finish. It's called What is Your Birth Mark? And I talk about how all of us have something that's our birthmark, whether it's a birth defect or something related to speech, height, something appearance, something family relational, culture, whatever. But there's something that I believe that happens to all of us that at one point in our life changes our course of our life. And so I say, what is your birthmark? Because I feel we should always take something that is our birthmark and make it for the good, make it positive, bring something good.
Well, and if I hadn't had a son with a Port Weinstein, I wouldn't be here today.
Right.
I wouldn't do trips with the I team. I wouldn't be presenting at
all over the
conferences,
world,
all sorts of things. So we can use those experiences to propel us to strengths and to good.
And do good. So Elaine writes again, I just think this is adorable. She needs to be one of our global ambassadors. So Elaine, it's at birthmark.org/ambassador. You need to sign up Elaine Douglas Rio because, or Rue, R-I-O-U-X, how it's pronounced. She said she was happy her daughter had a birthmark because she has one. So, I mean, you know, most of us wish, oh, is my daughter going to have my eye color? So she's like, oh, my daughter's got a birthmark just like me. I think that's adorable. I would love a picture of both of them. You got to send me one with both of you with your birthmarks. I would love to see that. It'd be adorable. So Jody is saying, is it a good idea to proactively find a support system, child psychologist, mainly for our child to help with coping mechanisms, limit anxiety? Is that even possible?
I think one of the things you can always do is create the best environment possible for that, like very open emotional discussions. I mean, I talk very openly about coping strategies with my children all the time. This is what we do to be healthy. This is how we talk about our feelings. This is what we do when we feel stressed. This is how we calm down. This is how you identify what's difficult and find a way to make it easier. I do think if children start to identify any issues, it is appropriate to say, hey, would you like someone to talk to about this? Because I really value therapeutic relationships. Because often children may not want to tell their parents, I feel bad about this, or I worry about the cost of going to treatment over and over again, or I worry about, this is probably for a child who's just a little bit older who could articulate more. But having a therapeutic relationship creates a really safe space where they feel okay to talk about things that they may be hesitant to share with their parents, especially because parents will always be like, oh, but we love you just the way you are. And sometimes they're a little bit dismissive in their hopes of shaping or sort of view of the situation, when we want to be sure they're also allowed the freedom to really explore any emotions around that. But I would say you kind of wait to see if someone evidences a need, if you start to see behavioral changes or issues, but I always offer that to my children, even who don't have birthmarks. If there's ever a time when you think it would be helpful to talk to someone about things that are going on in your life, I can make that happen for you. We can find someone who can be a support for you.
I have a question too, because Magana is 4. That's Jody and John's daughter, and very articulate. So next year she'll be in kindergarten. And my question is, like, should they be preparing Meg to have a dialogue to say to other children when they say things to her like, what's on your face?
Right. And I think that is really helpful to sort of be sure that she feels comfortable before she's going into a new social setting of, how do I want to address this? Do I want to explain it to my class ahead of time at the beginning of the year? And I'm also not just the kids in my class, but I'm going to encounter other people in the school, at lunchroom, at the playground. How do I want to respond to this? And if people ask me things, what are the ways that I want to have control in those situations? So it's a lot about preparing them ahead of time of what's the best way to feel in control. Because, you know, we want you to not feel flustered or frustrated or upset when someone asks you a question, and trying to minimize to the curiosity that children have, that it's not necessarily malintent, that it's just a lot of curiosity, and the more that you
just
can
not
explain
knowing. And like when I did the presentation in Greece, and I talked about how children, all children, you can have twins, both experience the same pain thing. They may both fall down, but they could both experience pain a completely different way, correct? Like same kids, twins. And isn't that true? Like you may have one kid that's like, yeah, man, I want to get up there and tell everybody in the class about my birthmark. And another one saying, I'm not going to talk about my birthmark. And you should probably like take the cue from the child, right?
Exactly. Because one of the most difficult things is, especially with visible differences, you don't have a choice as to whether you disclose this to other people. Unless your birthmark is in a place where people won't see it and it's covered by clothing, you don't have that sense of control. And some people are like, I really don't want to get into it, or it feels private or personal. And those are really important to give as many sort of boundaries or a sense of privacy and control. So if somebody's not interested in talking about it, it's okay to say, yeah, we'll just address it as it comes up, but we we don't have to make a big deal about it. Some kids really don't want any production around it, whereas others feel more comfortable because it minimizes future.
And I think parents need to understand that, like, whatever you say is a good way of dealing with something, that doesn't mean if their child's not doing it, there's something wrong, because every child feels different about different things. Like, even adults, like some of them say to me, why I would never get my port wine stain removed, and others say I don't want to go out without makeup on, and others say I'd give anything to have it gone. So there's different people
and at different
kids,
stages, right? And developmentally, when we're looking at this developmentally, even just the cognitive process, the way children process and understand self versus others, different emotions, all of those things are really changing a lot from, say, a pre-operational preschool stage, moving into a more literal middle childhood stage, moving into adolescence, which is more sort of identity, young adults moving into relationships. There's different ways that birthmark is going to affect them, and their feelings towards it, or maybe the way that it's limiting or impacting their life will sort of shift and change as they go through those experiences.
Yeah, that's really interesting. So Sarah has a great question. Do you have any advice for a mother of a 2-year-old with a lip hemangioma who feels really angry when people say, what happened to his face or what's wrong? He doesn't understand now, but at some point he will, and she doesn't want him to think that he's less of a person because of it.
Well, I think it's really important to always try to separate who they are from other people's interactions. Like, sometimes we have to point out that people can be really rude and say unhelpful or inappropriate things, not just to us, but people do that all the time in the world around us. And yes, they might do that because of this, but again, it's not your choice. It's something they don't understand. It's something that they're curious about. Sometimes people do, especially adults, as we all know, are often way worse than children about saying things that come across that you're like, did no one teach you tact? Did no one teach you manners? It's not even your business to ask me about my child. But I think one of the things is he's still at an age where I don't think he would really be processing as much. And you can even say something. If somebody asks and you respond, you can say, a lot of people are always curious about things they don't know. So you kind of create closure to the experience, which frames it as curiosity instead of someone being mean. And so in some ways it's, can you kind of channel your emotion enough to, and I like to think of it this way, that all of us are blind to different things in life, that are, we know what we know from our own experiences, but if we didn't have those experiences, we are ignorant of things in other people's lives as well. And so I try to be generous and give people the benefit of the doubt, even when you think they should know better, they should be more polite. But I just try to think, if they were living my experience, they probably wouldn't ask those questions, and they would understand that that's sensitive.
Well, and I mean, in my study, and I'm waiting for some more questions, so please ask your questions, everybody. There's no such thing as a dumb question.
I know.
They're always
we'll
great
always
questions.
Answer.
They're always good. In my survey, I was shocked that of the 60 women that completed it, 9 of them said the delivering doctor made a rude comment or made them uncomfortable, like, oh, you're going to have to watch out that your child may have seizures. Oh, your child may have cognitive impairment. So it's one thing, like you say, to want to educate people, but when it's somebody that you're expecting to be highly educated and they say something to you, how do you address them? Like, here's a mother giving and I was so upset over that I reached out to the OBGYN Society of the USA, and I'm working with somebody on actually creating a dialogue with them about this, because I'm like, why would a doctor say that to a new
not
mom?
Really appreciating, first of all, that experience. And I think a lot of these things come about because people aren't stopping to think, what does it feel like to be that person? What are they thinking and what are they feeling right now? And as child life specialists, that's always one of the key things, is anytime you're working with a patient or a family, what does it feel like to be them? And so a new mom is just slightly overwhelmed. You're still in a crazy space hormonally. Your body's just gone through probably the most difficult experience you'll ever go through. And I remember even like seeing the port wine stain on my son, not knowing totally what it was, having it misdiagnosed by doctors in the hospital who said it's a hemangioma, it'll go away, you don't even need to see someone for like 6 months, which I knew from doing medical missions with Operation Smile and had seen a lot of hemangiomas. This is not a hemangioma. So there it was, the first day home from the hospital. I'm Googling, trying to find providers, you know, found VBF, found different things, but yeah, they can't appreciate how an offhanded comment or something that really they don't have enough information or expertise to give
you know, that's their job. So they're there on their job, delivering a baby, they deliver.
This is out of their realm.
Yeah, right? And so, but that whole, hello, that's their precious joy that they've been waiting for, you know, like.
You're already struggling with enough emotions, let alone, oh my goodness, what does this mean for my child the rest of their life? And a lot of people put doctors on pedestals, like what they say is the gospel, which isn't true, as you know. Yeah.
They said your child had hemangioma with vascular birthmarks. 65% in the U.S. alone are still misdiagnosed, and that's pretty scary. Jenling Jiang has a good question. She says, what is a good age to discuss the birthmark with your child and what it means?
For me, that's a discussion that occurs ongoing, and it evolves over time developmentally. So children, very young infants, don't even recognize themselves when they look in a mirror. You really don't see that till after a year. You know, there's kind of the classic, if you put a dot on their nose, will they touch the mirror or will they touch themselves because they realize that's them that they're seeing in the mirror. So, but I think it's just always very straightforward. If they ask what it is initially, you know, in earlier stages, you might say, oh, that's a birthmark. I have a birthmark on my body, or we all have things that are a little bit different. And you kind of try to normalize it by showing that other people have differences too in the way that they look. And then as they get a little bit older, you can explain it much in the way like when you exercise and your face gets really pink. And you think about, because there's all of that extra blood flow in your face. So, you know, when you have a port wine stain and it's pink there, it's because there's more vessels and under the skin, but it's not anything, just like it doesn't hurt your face when you're exercising and it's pink, but it gets red. The port wine stain doesn't hurt even when it's pink. And it just always stays that way because of the nature of the vessels that are in that area. And so just kind of explaining things like that, and it just sort of keeps evolving, and its meaning will play out differently in every person's story.
And plus, we're having more and more parents self-publish books on port wine stains that I think are adorable for other kids. Like there's a new one, Marvelously Made, and it's adorable on how her little brothers think she's marvelous. And I just think it's a cute little book. We have the Buddy Booby birthmark book, and there's some other ones that I think they just are good for kids to read.
It's good for kids to always see the variety. Like I love to expose my children to things in art and nature because those value diversity, right? It's the beauty if you look at this landscape versus this, or this flower and this rock and this, it's the diversity that's beautiful. If everything is the same, it's not interesting. And as an artist as well, I'm like, no one wants to go to a museum where every painting on the wall is painted exactly the same. And in fact, you try to create distortion. You try to create your own way, your own technique, your own method. Everything isn't designed to be photorealism. So I think really trying to just raise children in an environment that's very accepting of those differences, that acknowledges them without a sense of negativity, that they're differences, but one isn't good and one isn't bad.
I think that message is so critical today, especially with social media. And where 50 years ago, we didn't see people all over the world in an instant or their birthmarks. We only saw the people we knew, or, you know, I'm just saying. Now with social media, everybody sees everybody and everything, and everybody's commenting on it. So I think it's just
and I think it's really healthy too to have your children encounter, whether it's coming to a conference, to see other people with a birthmark. I think that is one of the most validating, relieving experiences often for children, to just be like, oh, someone else experiences that. Even for adults, someone else experiences that. And I think we do have to be careful of the media realm that we live in today, because it's very image based. It's very image conscious. And there is research that shows, following certain types of Instagram accounts or certain, ideals of beauty can lead to decreased sense of self, body dissatisfaction, desire for thinness, all these different things. So we do, and I talk very openly about that with everyone, like teenagers I work with, not with birthmarks, that I'm like, you need to think about the way that you're processing the images you see, how you're learning to identify yourself in relation to those, and really not allowing the sort of toxic negative impacts of sort of the flood of images and idealization of body forms to be negative.
So we got a lot of questions coming in. Chelsea Vincent Pentecost, what a great name. Sounds like she could be an author. She says, as mothers of, especially to you, a mother of a child with a port wine stain, do you remember the first time you asked about their birthmark or the first time they had any bullying situation?
My son hasn't had a lot of bullying with his. I think he's had a lot of questions, but to my knowledge, I'm not aware of anyone overtly bullying him because of it. More often people would say things like, I think North bumped his head, like it's red right here. And I was like, no, it's been there always. I can't remember him asking about it, probably because it was probably known before he even, we would refer to it, but it was just a part of growing up, and he was never like, why do I have this? And I was involved with VBF. I mean, I was speaking at conferences before he was even out of a French terrier.
He was getting treatment early too, right?
So there's an awareness that comes just from the dialogue that occurs around those things, that it was never like, I have to tell you about this, or it just evolved and grew over time in that experience.
Nicole has a great question. Are there signs and symptoms to look for that your child is getting teased or bullied more than they are telling you? And how can you help them?
Okay. One thing, I am a big believer in journaling for children of all ages and for everyone, as a really good way of kind of self-honesty, working through. There's some incredible journals that are designed by Art with Heart. They're designed by child life specialists, art therapists. There's one called Magnificent Marvelous Me. There's Ink About It. It's like one's more for like early childhood, that's sort of like drawing and writing about different things. Ink About It is more for like a tween audience, but it asks questions like, what are the most stressful things you've had happen in your life? On a scale of 1 to 10, how do you rate that in terms of stresses? And I would have my sons do these, and sometimes I was really surprised at the things like, how much does giving a presentation out loud stress you? Or how much does the thought of this? And it was things that really surprised me that I didn't even know about my children, who I feel like I have really good dialogue with. So children always have things that surprise them. And the more we can create opportunities for them to share and open up, the more we can understand what they're feeling and thinking. And I would say anytime you start to see a child exhibit signs of depression, avoidance of things, loss of interest, in a significant way of things that used to be fun for them, avoiding certain relationships, situations, that's when you start to just ask a few more questions. And you just say, and it's okay to also do check-ins, to say, you know what, let's just check in every once in a while. We won't talk about it all the time, but will kind of check in with you and see how things are going, and if any part of that's particularly stressful. And sometimes you also say in advance what they might be experiencing. Like, some people think it's hard because people stare at them a lot. Is that the hardest part for you? Whereas other people say, no, the harder part is, and just so you kind of give them a few different options that kind of make you realize you already know what they're going through. Because sometimes they think, oh, they don't know, it's my secret. And you're like, oh no, so kind of throwing it out there ahead of time can open that.
Do you think it would be good to, as a rule of thumb, say a month into the beginning of a new school year, especially if it's a new school, that mom or dad just checks in and says, and
I would check in the course of checking in on all sorts of things. How's it going with your relationship with your teachers? How are you doing developing friendships? What are the hardest parts for you? Is there anything, that's difficult for you? Because kids are always going through constant changes. And if you have a really consistent dialogue where you can ask about a lot of things. It's not just like, well, I only want to talk to you about your birthmark. I want to talk about your whole well-being. This is a part of it, but it's all of you that I'm, wanting to be sure is doing well.
Yeah, Sarah Grace Van Dyne has a great question. She's like, yes, it should be okay to talk about it. Growing up, I never felt like I could express my negative emotions around my birthmark or even acknowledge the differences I was experiencing, especially the swollen blood vessels when crying and running, etc.
Yeah, that it becomes more prominent. And sometimes you're like, this is the last time I want it to become more prominent. The last thing I want to do is draw more attention to myself. And I think, Sarah, you're really right that being able to openly talk about that and to not make people feel ashamed for feeling those, because any of us would feel those. So we don't want to dismiss those emotions or say, oh, that's not true. You don't feel that way. That's not. Instead, we want to say, well, yeah, that would be really fun. What can we do to give you more of a sense of control? What can we do to make that experience more positive? And then you take that energy, that negative energy, and you can sort of transform it and direct it in another direction. But I think it's really important to enable people to say, yes, this is hard. This is not easy. And to really feel safe, like you have someone that you can talk to about that in a safe and open way is really important.
So Jody has a great question, and it's along the lines of what I told you. And I spoke about this at our board meeting, that after I finish a session with one of our experts, I create a list of questions, and hers is there a list of questions that we can ask our children and that we can refer to this list? So maybe that's something tonight that we can put together as part of my list is what kind of questions, like, hey, I like the way that you put, so how's school? Did you make any new friends? You like your teacher? What's your favorite subject? Anybody bring up your birthmark?
It's
just kind of like slip it in there.
Because what you want to is we don't want to draw negative attention to it, and we don't want to make it the thing that defines them.
So you don't want to get any more weight.
As long as it's in there with, how are there any other extracurricular activities you're interested in pursuing, or what's this, that it's just one of those questions that, oh, I just wanted to check in on that, because if there's ever something you want me to do about it, I just wanted you to know I'm here for you about it. And I know that sometimes that's not easy. And
I used to say to my daughter every day, because she was like the kind that wouldn't speak, like she was like sealed shut. So I'd say, okay, what was the best thing that happened today, and what was the worst thing that happened? And then I'd get her to talk at least, and that's a good way, even if you do something that simple, like, okay, tell me one good thing that happened today at school, and then tell me one bad thing that happened at school. We'll talk about it. Just one of each, and then they'll be like, well, I met a new guy. Oh, yeah, somebody said something. And then that opens the door for not just talking about a birthmark, but anything that might come up, right?
Because I think, too, realizing that if you want your children to feel comfortable talking with you about that, they also need to feel comfortable talking with you about a lot of things. And that, really developing a relationship of trust is critical. And I love to capture my kids when we're riding in the car somewhere, and I'll be like, your top 3 favorite this, or top best that, or, anything that just prompts different emotional discussions, or the worst thing that happened at this, or, giving them a chance to really be expressive, I think is really important, because those are the skills that enable us throughout our lives to cope with all sorts of things. And the way that we cope with challenges that we have, those coping skills build on each other, right? So the skills that we have when we're using good coping prepares us to meet the next demand. It prepares us to meet the next demand. But if we're not coping as well, they don't necessarily take us to as positive of growth places, but they can kind of get us a little bit turned around.
I had a mom ask me the other day, can you find me another mother with a child my daughter's age that has a port wine so they can meet each other? And my daughter wants to meet, and she's in this really remote area of Texas. So fortunately, I know a really good dermatologist that treats port wine stains. So I wrote to him, and I'm like, I know HIPAA and I know all that, but here's the issue. And he's like, let me work something out. So, it's true, especially if you live in a small town, that child would be the only one that anybody in town seen with a port wine. or people could have them and they just weren't noticed, or they're just insignificant. But then you get somebody with a prominent one and everybody's like, did you burn your face? What is that? Were you in the sun? Did you lay on one side? These are all the things the parents tell me.
Well, and I think too, having peers that have that experience also is really important. So being able to talk to another kid who has that is really helpful, especially as kids get into late childhood, early adolescence, mid-adolescence, because you just want to say to someone, oh, I totally get that. And I know when we have sessions when we do psychosocial support sessions at the conference, we have really meaningful discussions. And I love hearing kids talk back and forth about their experiences, because it's very validating to hear someone else say, oh, that happens at my school. Or, oh, yeah. And sometimes we're like, if we could make a poster of all the like crazy things people have said to you, and every one of you could put a check by probably the same 7, worst comments. And so just knowing someone else experiences that and having someone you can talk to about that safely is really helpful. That's not just your parent, not just a doctor, but peers and other families, I think is incredibly critical in terms of going through this, because when you think about the supports you have, you may have family members or friends, but they haven't likely encountered this before. So while they love you and want to support you and can be social support, they really don't know that experience. Physicians are great in terms of information support, but they don't have the time or aren't involved in your life in a personal way to really be a support in that. And so having other families who are going through this is a really valuable support, because you can share ideas and tips, suggestions, commiserate over the hard parts, cheer each other on, and really also create relationships of support for their children, because you're another safe adult then who knows and understands what it's like to live with that. And so you can also be a mentor to these other children as well, even as a parent, because you're going through it with your own child and can really appreciate the needs and emotions of those children.
Chelsea made a really good comment. She's like, that's how I grew up, in a remote town. Nobody even knew me. Thank God for social media. And when people say stuff to me like, oh, it's the devil's invention, and I'm like, there's probably children that have been saved because of VBF being able to see an ulcerated or misdiagnosed, or getting information about treatment out there. And I know that it has bad, but boy, it really has good. Maybe, people don't like their pictures out there for everybody to see with their birthmark, but a lot of people are getting into proper treatment diagnosis because of social media. Yeah. So, we have different programs through VBF. We used to have like a program with teen to teen talking, and now what we do is at the conferences, like we split the group so that you have like the young adults, and we now have, and Jody and Scott are involved in it, like a room dedicated at the conference for people and to meet and share their stories.
Well, and I think too, sharing your stories on social media about your experiences are very helpful, because if we want people to have empathy and compassion and think twice about what they say or how they interact with us, when we use our stories to help people understand what that experience is like, you change other people's reactions when they see someone. They think about, oh, I remember reading about someone who looked like that and what that experience meant for them, or how difficult this was. And they're likely to then interact in a slightly different way. And so I think the more that we're willing to use ourselves to help bring good for others, there can be purpose and power in that.
Jody's asking a fantastic question, because Meg's little sister Serena is going to be very aware soon of her sister's birthmark. So like Jody's like, so what do we say to the sibling that doesn't have the birthmark? Like how should we talk about it to her? Should we bring attention to it or not?
I think you let it be pretty naturalistic. When they ask or identify what it is, or in some cases it comes up, it just becomes a part of their world, like they know other things, like, oh, they have allergies, or oh, they have asthma because we're going to that doctor today. But it's not like you have to sit down. But if they say, what is that, or why is that, that's when you say, oh, it's a birthmark, like just like you would with other people. So I think even with siblings, you don't want to make it, again, too much attention focused on that, because I think also parents struggle with the feeling of adapting sometimes in family systems, right? Adapting around the child who has a birthmark, because there's extra doctor's appointments, extra this, extra that. And so we let it come up as it plays out in the story, but we don't use it to define the story or define the person. It's just, oh yeah, that's something that they have. And we just, again, explain it developmentally. It's going to evolve over time. And you can always say it doesn't, one of the biggest things when children are young, it's not contagious. It doesn't hurt them.
Right.
Like those are the two fears that children have
for their siblings or even their parents.
With anyone with medical conditions, because they can't quite understand things they can't see yet. And if it's red, they think like a burn, or if something gets scraped, they think it's probably painful, or they wonder if they can catch it, right? So those are the things that we just want to kind of affirm to them or address to sort of head off any very common misconceptions and cognitive sort of.
Sarah Grace Van Dyne has a nice shout out to us. She said, before I found this group, I'd never spoken to anyone else who had a similar birthmark, and it's been so helpful and healing to know that I'm not alone in these unique struggles. And Jeff's on now from VBF, Jeff Bergen. He's recovering from surgery, so our thoughts and prayers are with you. You're probably sitting there watching us now, relaxing and having a nice beverage. So, but heal quickly, and I'll see you next month. I put questions and surveys out there, and I found it very interesting. I guess the extremes, so there's all the ones that center around the middle, and then there's those outliers. And I guess I don't forget those, like one guy with a port wine stain in Boston was pulled over. He was walking on the street and police pulled him over because they thought he was in a fight. Because he has a really, really very prominent port wine stain. He's like, what, this is a birthmark. And the cops are like, what kind of birthmark? And he's like, and he's pulling up the phone and showing them the birthmarks and stuff.
But again, you can even see from that story, they were prompted to act out of concern.
Yeah.
Right? Like they were thinking, we want to help, or like, we don't want something bad to happen to you. And so it was funny that he has to like show and educate and no, really, it's a birthmark, trust me.
Well, and one of the reasons I created this great card, maybe somebody can post it in our comment section on here. It's called It's a Vascular Birthmark. And on it is like 30 or 40 pictures of children with their port wines, hemangiomas, venous, and with purpura. Because a lot of parents that would leave our conference would get stopped at the airport by the TSA and think the parent,
what happened?
Did the parent hit the child? One of our moms, she's usually on here. She's not on today. I didn't see her come on. Oh, shoot. Sorry. We're here. Sorry about that. Maybe they didn't lose us. One of our moms was getting treatment in California with our laser expert. And during the night, and she stayed overnight because she was from Texas. During the night, a cop knocked on the door and said that the cleaning lady reported her for child abuse, for abusing the kid, because he had just had the laser and had all the purpura on his face. And they were quote unquote child protection. Oh. So, I mean.
Well, and I think that's another issue too, like in talking about how do you talk about it. With port wine stains, one of the big discussions is also talking about it post-treatment, because it's one thing to have your birthmark on a normal day. It's another thing to have your birthmark post-treatment when you have the purpura. And that's actually one of the hardest times that people will talk about is, I don't mind the treatment so much as it may be some discomfort, but what I really don't like is the 10 days afterwards in which even more attention gets drawn to me. Like, I'm okay with how I am normally, but that's not even normal me. That's out of the ordinary. And so that's often, again, an important time when, if they're in school or around other children, to just say, it's from a laser. It's just a bruise that happens because it's treating the vessels in that area.
And one of the things that Scott brought up on our PBS video, which I'll have to send you a copy, it's, by the way, the VBF PBS Vascular Birthmarks Awareness Program will be running on December 12th or 14th. It starts on PBS nationally. It'll be running for 6 months. So it talks all about why Dr. Geronimus does a great job of saying how doctors weren't taught about this in medical school, early intervention, and Scott gets on and says there's a new dynamic now, and he's the adult, and his son's friends, his son's 7 or 8 and very active in sports and social events, and his friends are now saying, hey, what's that on your father's face? So that's brought a whole new kind of a dynamic to us, where I'm like, wow, yeah, I guess because now BBF's 25 years old, some of our babies that had Port Weinstein's 25 years ago are now becoming parents themselves, or maybe they were 10 back then and now they have a 5, 6, 7, 8-year-old and their kids are saying. So like how would you use the same dialogue, like if it were the parent?
I probably would, and I would, if I was a parent with a birthmark, I think I would talk to my child and be like, I'm sure your friends make comments sometimes. They probably don't totally understand it. If they ever ask questions, you can say this, and even as a parent, you can volunteer that. Like, hey guys, nice to meet you, or at some point you might be like, you probably wondered what this is. It's a birthmark. Like, if you ever have a question about it, I'm happy to answer it.
1 in 10 are born with a vascular birthmark, 10% of the world.
So I think we just, again, as, a way of giving out information, and sometimes volunteering information is easier than putting your child in the position of people being like, oh, what is that? Being afraid to ask or making it uncomfortable. But
and simultaneous to me bringing this up, Chelsea was asking the same question about, when my kids, like wondering when they get old enough to ask me. So you addressed it. Sarah's saying she has the card with her at work. Showing people is one of the only ways people believe me. Thank you so much for making that. It's a vascular birthmark card. Thank you for saying that, Sarah. Growing up, my mom had child services called on her because of my birthmark too. I actually, the night before I left to bring my daughter to Arkansas to have her hemangioma removed, I was in a big chain supermarket where I live, and 3 aisles over, a woman screamed over to me, was your daughter born like that, or did you do it? And I didn't get mad. It was a confirmation that I knew going to Arkansas and having that tumor removed from her mouth was the right thing to do, because people were saying to me, she doesn't need surgery, when she couldn't speak, when it was affecting her eating. And I just needed that. That comment was like,
sometimes that galvanizes. Sometimes difficult moments sort of galvanize us to action, or galvanize us to advocacy, or whatever that is, that it gives us just that little bit of, yes, this is what I need to do. I need to increase awareness around this. I need to get this treatment. I need to, it prompts and propels change.
Yeah, and I'm just amazed too at the resilience. I'm just the resilience of some of these kids that come to our conference, and I observe them and I see that some of them have like a Port Weinstein swag, I want to say. Like, you can tell that they're at our conference and with other kids just like them, and that they're just proud. They're just like, hey, I'm, with other people just like me, I'm walking around, and I'm like, oh, thank you, God, for giving me this opportunity to create VBF, because I love seeing the kids, more than anything, interact with other children. Mm-hmm. And I say to myself, I wonder how many other children they saw. Is this the first time? And you go into the daycare, which I love to do, and you see them looking at each other. As a matter of fact, we got a picture last year of 2 little boys the same age. That picture was so powerful of how they were inseparable. They were both like 3 with the same port wine, that the laser company, Candela, used it on the cover of their magazine.
Love it.
And we've used it too. Yeah.
Well, and I think too, it's, just that sense of I get to see a lot of people at the conferences, and I get to see incredible people who have birthmarks. Like, it does not define their whole life. It doesn't limit their strengths or their opportunities, their potentials. And so I know sometimes parents get really worried their child's at an earlier place in the journey, like kind of fearing all of the difficulties that are ahead of them, instead of also thinking about all of the positives. that are ahead of them and all of the potential that they have. And it's easy to get so worried about all of the, like, I don't want to mess up on this and I don't want to mess up on that, and I don't want this to be hard, that we stop to really appreciate all the amazing positives that are ahead of them and just how resilient people are and the incredible contributions we all make, that really a Port Weinstein does not define our strengths, our talents, our interests, our passions, our hobbies.
I see a lot of adults saying that all the time. And we're almost done. Can't believe it's been an hour. We have 6 minutes left, but Jody brings up, she's always got the best questions.
Yeah, good job with the questions, Jody.
But her and I had the identical path, because she got so fed up with people saying stuff about Meg's birthmark that they created the Purple Polka Dot Race, which is now going to be another one. It raises awareness, it raises money. I did that for VBF because of my own daughter, because there was nothing and people were acting like I made this up, like my daughter has this tumor that needs to be treated, because people are like, what are you talking about? She has to have surgery. I mean, isn't that a powerful way of paying it forward or making a positive out of a negative, is taking something like this port wine or my daughter's hemangioma and creating a complete awareness program. Mm-hmm. And that's why we want dads to be global ambassadors, to get the knowledge out there that there's early intervention and early treatment. And I go to the Purple Polka Dot Race every year, and there's always families that come up to me and ask questions and that want to know. So, I mean, but is that a interesting psychopathy, I guess is what I'm saying, is a small percentage of us take something and we create something from it.
Well, and I think that's something that I often recommend professionally to people in any sort of circumstance. If you're dealing with a loss, which having a child with a birthmark can be a loss of unexpected, typical experience, right?
Right.
Because no one thinks this is exactly what I'm going to have. So there are griefs or losses, or sometimes people grieve that typical experience, or, you know, whenever we encounter difficult emotions, we can acknowledge the emotion, but then what else can I do? What can I do to honor my child? What can I do to show how much I care about my child? And then we use that to propel us to action, right? We use that. So instead of saying, I could just stay home and cry all day, that probably doesn't yield anything in the end. Is it okay to cry sometimes? Yeah, it totally is. Is it okay to say, I feel sad, or I'm really struggling with this? But then you can say, so what am I going to do about it? What am I going to do about it that makes life better for my child, that makes life better for other people's children, that, you know, helps to improve treatment, that helps to improve awareness, that helps to, there's so many different fronts we can sort of advocate on or connect with. And so really taking that opportunity to direct yourself, acknowledge the emotions, but then use your power to create from that, to honor from that, to memorialize from that, by going and doing and dedicating those actions to really honor.
And look at the famous people that have done that, Michael J. Fox and Christopher Reeve's family, you know, and just taking what they were given and then bringing something really wonderful and powerful. But that's also educating people. I think that's key. And before we go, so Nicole Muse asks a great question, and I'm so excited to tell you, Nicole, that we now have a parent networking room at our conference every year, and she's asking, is there like a happy hour or playtime? So what I will do, a couple people that are on right now are on the committee, our annual planning for our conference, which is 10/10/2020 this year. So put that on your calendar. It's a great date, right? 10/10/2020. So yeah, we can get a room, Nicole. I do believe we have one now. In the morning are all the lectures and the free daycare. And then in the afternoon are all the clinics, but we can get a room dedicated. We'll announce it. We'll put it in the program. We'll put some cookies and snacks and some toys and stuff in there for the kids. And we'll keep that open from 1 to 6 for families to go in and out of and have a place to like meet. That's, I mean, we cram so much into, you know, from 7 in the morning until 7 at night. That's really,
and always get down there early for breakfast and chat with people, you know, like take all those opportunities to just, And I know sometimes people are sitting at tables and kind of trying to process stuff, but everyone loves to have someone just, because sometimes we're all in those difficult emotional spaces. So many people are there like hoping to get a diagnosis. Like there's so much emotionally riding on those conferences and clinic visits often for people that sometimes they're a little bit distracted, but they would love it if somebody comes up and says, hey, I'm so-and-so. I'm so glad you're here. Just like a really kind greeting. But yeah, get down there, stay down there, grab people between breaks. Just, you know, I think that openness and friendliness is,
and don't be afraid. If you have a little girl that's 3, 4, 5 years old and you see another one, say to the mom, hey, can I get these two together and bring them to, so my child can feel, you know, a sense of other people. So we're out of time, but any final words? And thank you so much, as always, for being here, and happy holidays on behalf of VBF to everyone.
We hope it's wonderful for everyone.
And any final words for families during the holidays? I mean, you opened up with that, so let's close with the holidays can be tough, and then having a newborn, especially this time of year. Some words of wisdom.
I think especially moms. For new families that are just dealing with, you know, a recent birth of a child or trying to find diagnosis too, this can be a really tough time of year because you're still sort of hanging in limbo, hanging in questions. Sometimes we don't know the outcome of treatments yet, or we're kind of waiting for things. And it's hard to feel festive. It's hard to feel excited because your brain is just like, I have to help my child. That's all I can focus on right now. It's kind of a consuming energy at times. But I think you just stop, you take it as you can. You think about ways to help yourself cope, right? As a child life specialist, we always say, what are the stressors? How can I help myself cope with this? How can I get through this? You know, maybe I need to take a break for a few minutes when I'm at a big family gathering and just go to the bathroom and collect myself, or come back. Maybe I need to think about difficult conversations or have a wingman with me. You know, some things like that. People who can help protect you a little bit emotionally if you're feeling vulnerable at a certain time or in a certain situation. So just think about what's the hardest part for you, and then try to pair coping with that specific.
Wonderful words. And again, what's a vascular birthmark? That card is made available for free for you by reaching out to us at birthmark.org, at Lauren, I believe it is, .birthmark.org. And we highly recommend you carry it around with you. And again, you can reach Leslie through the VBF website if you have any additional questions. And again, and we wish you all a happy, healthy, and safe holiday season. I'll be back next month in January with Dr. Stuart Nelson, our port wine stain expert from California.
Sounds great. We'll hope to see you all at the conference next year.
Yes, hopefully. See you then. Okay, so now here we go.